Hi, this is Leonard Evans giving you my interpretation of why our healthcare costs benefit powerful lobbies rather than the patients they're supposed to help. We have all heard that other countries pay less than half what we pay in the US for healthcare, yet they have better outcomes and cover everyone. You might hope that such a stark claim ought to be central to our healthcare debates. Instead, we have endless passionate confrontations about things that are largely irrelevant. There are clear reasons why we pay more than twice as much for an inferior product. There are clear reasons why politicians do not address these reasons. An enormous portion of what we pay through our insurance premiums is for things unrelated to healthcare, things that folks in other countries are not compelled to buy. I have included the non-medical expenses under four broad categories: medical malpractice litigation, price fixing by drug companies, advertising and media, and the insurance industry. Let's first look at medical malpractice litigation. After every bad outcome, a healthcare provider may be sued and is therefore obliged to buy liability insurance. The settlements constitute just the tip of the iceberg. If a plaintiff wins, the media often report it as if the amount went to the injured person. This is not so. The lawyers have so arranged this whole racket that we are not even allowed to know how much, if anything, the injured party got. The settlement is distributed in so many ways to the lawyer, to the expert witnesses, to all the travel that was involved. All of this comes out of what is supposed to be the injured party's portion. There, of course, are similar defense lawyers' costs. All of this paid for out of the medical budget. Courts cost money to run. Salaries have to be paid to the judge and the other participants. There are jury costs, and so on. Defensive medical processes occur with no purpose other than legal defense. This activity is not only expensive, but it actually harms patients. Who wants an extra x-ray? And of course the whole process generates additional forms. They cost money to file and maintain. Bureaucracy costs money. We pay extra for our healthcare costs because of price fixing by drug companies. In the United States, it is illegal for companies to collude to fix prices. One industry is exempt from such laws, and that industry is the drug industry. Now you might well ask, why should the drug industry be exempt? The answer is very simple. It is the industry that has the means to adequately bribe all of Congress to have such a law passed. Here's an example from the Washington Post. In 1996, the drug Humalog was selling for $21 per vial. This is a product, the main content of which is knowledge or intellectual. In such cases, you expect the price to get less every year. We would expect by July 2016 that the cost should have dropped to about $3 or $4. But what do we find? Instead of dropping, it's gone up to $255. There are a number of manufacturers. It is priced identically by each of the manufacturers. Each time there's an increase in price from one manufacturer, the same price increase applies to all. Drive near any airport in the US and you will see billboard after billboard advertising injury lawyers, lawyers helping you sue your medical provider if you've had a bad outcome, and so forth. It is your medical cost that is paying for these billboards. Television advertisements by plaintiffs' lawyers soliciting your business, invoking medical malpractice if you're not feeling great, etc. On television, especially cable, advertisements for expensive drugs. Ask your doctor if this is for you. A good portion of media income comes from your healthcare dollar, which is why the media never presents this story. Insurance industry, an enormous industry to which we pay a large portion of our healthcare costs, the industry cures nobody. Insurance industry infrastructure, it is our medical costs that pay for the lavish insurance buildings that are prominent in every city, pays for the employees that work in them, and so on. Large numbers of insurance industry executives have outrageous compensation packages paid by your healthcare dollar. Private insurance is simply a parasite that adds enormous cost to our healthcare but provides zero healthcare. Despite all of these costs, we still have to pay through our taxes for government monitoring and enforcing the many rules of our complex, phony private system. Our healthcare debate ignores the core feature that our healthcare dollar rewards interests that pay for the campaigns of congressional representatives. There is still good news. We have by far the best healthcare in the world, but it is only for those who have easy access to it. Those with Medicare plus good supplemental insurance, employees of large, rich corporations, and so on. Millions in average jobs fear that an illness will be untreated or cause them financial ruin. They live in a situation of stress which itself causes illness. There are millions who are uninsured. Is there a good solution? Alas, no. But there is a bad solution that is better than our current disaster. Ever since we agreed that anybody in need must receive medical help, we made health care a government responsibility. Government is already steeped in providing health care. Let's look at Medicare. It already covers those aged 65 until death. A very small change in the law could make this from birth until death, and that would take care of many problems. A U.S. government acting in the public interest could provide universal health care. We can afford it by ensuring that the health care dollar is spent only for health care. Simple law changes can drastically reduce costs. For example, make all providers immune from malpractice litigation, just like the military. If a medical malpractice issue does arise, it should be addressed administratively. Clearly, there is a great deal wrong with that, but compared to what? Remove the drug company immunity from price-fixing laws that apply to every other company in the United States. This will drastically reduce prices through competition. As for the future, I'm afraid there's little cause for optimism. It will take a much bigger political revolution than the one that occurred on November 8, 2016 to change much. Since the new Congress has arrived, we've had to listen to endless discussion, with the goal being little more than replacing smoke and mirrors with mirrors and smoke.